While working as a direct support professional, your role includes assisting people with a variety of activities of daily living, either within their home or in the community. Without proper training, however, employees are at risk of injuries such as strains and tendinitis. These musculoskeletal disorders, or MSDs, are becoming more common, but they can be prevented. In today's video, we'll discuss the importance of proper training and risk assessment. Working with supervisors and joint health and safety committees, we can all minimize employee injuries in the home or community setting. Please note that not all these solutions will work in your specific environment. By conducting a risk assessment and holding discussions with your supervisor and joint health and safety committee, you can develop individual solutions to support people at home or in the community. Let's define some of the terms used in this video.
Participatory MSD prevention program. This is a program where key stakeholders come together to review what the risk factors are and come up with suitable solutions for that risk. Oftentimes you'll find that a supervisor will be involved, the Joint Health and Safety Committee, workers and supervisors in order to develop those safe practices. Biomechanics is the practice of using one's body in a comfortable and safe posture. Activities of daily living, or ADLs if you're in the business, are those activities where we're assisting those that need help to do their daily regime, going to the grocery store, doing their laundry, helping with hygiene, recreational activities that they want to participate in. We're there to assist. Assisting people with mobility, any activity whereby an employee is exerting effort to position, move, or physically assist another person. Ergonomics is the study of human movement. We look at how the work or recreational activity is performed and how it can be designed to fit the person instead of the person having to adjust their own body and position to that task or recreation activity. Risk assessment. It's a process where you look at all factors of the task or work you're going to perform to look for hazards and then come up with what the solutions will be to perform that work safely.
Looking at the data, we find that 35% of injuries in community group homes are MSD injuries. 11% of injuries occur while providing direct ambulation assistance to the people we support. The most common injuries in this sector are shoulder and back strains. These occur while assisting those you support performing activities of daily living, such as pushing, pulling, lifting, repetition, and adopting a fixed or awkward posture. The signs and symptoms of MSDs include aching, burning, cramping, discomfort, fatigue, pain, and weakness.
So for the last month, my shoulder's been bothering me by the end of the day.
Oh, it has, hasn't it? Let's meet back in my office in about an hour. I'd like to go through what you've been doing through the days. We'll look at some of the risk factors that are maybe going on, maybe come up with a plan because we don't want that to get any worse.
Okay, yeah.
Consider symptoms serious that last all day or continue through the night and are still there in the morning. Whenever you have symptoms, regardless of duration, report them to your supervisor as soon as possible to minimize the risk of long-term injury. With a personalized prevention plan in place, Marie's shoulder should feel better quickly, and she can continue her job of supporting people who require assistance. Every organization needs a participatory MSD prevention program. Together, support professionals, health and safety committees, and supervisors can identify MSD risk factors and write policies, procedures, and safe work practices to minimize hazards in the workplace. For a prevention program to be effective, employees must be properly trained and monitored, and safe work practices must be implemented and adjusted as gaps are identified. One of the best ways to prevent injury is to keep physically fit. Eating properly and managing your weight allow you to perform the daily tasks required by a support professional. Aches and pains are normal as we age, but it's important to deal with them early on and consult with your supervisor. Remember, you're the best person to look after you. Proper biomechanics and posture will help you prevent injury. Follow these general principles when lifting items and assisting people. Use a wide split leg stance. Keep your upper body in its safe S curve. Keep loads close to your body. When picking up items from the floor, bend from the knees, not from the waist. Push instead of pull whenever possible. It's better to move several small items than one large item. Take stretch breaks and rotate tasks to prevent injury. Later in the video, we'll demonstrate these principles. Performing a risk assessment helps determine the best way to keep yourself and others safe. Here's an example. Before attempting to assist a person with ambulation, consider the following questions. Is the path free of hazards? Can equipment help in any way? How do you expect the person to react? How are you feeling? Do you need help? How urgent is the action? Is the equipment set up correctly? Before helping a person move, perform a care mobility review. C is for communication. Make eye contact. Is the person you're supporting able to follow your direction? A is for ability. Has there been a change in physical ability or energy level? Can the person move their legs or arms? Can they help? Are they drowsy? R is for resistance. Is the person agitated or not cooperating? E is for equipment. Are there any obstacles along the travel path? Is the equipment functioning and positioned appropriately? If you're using a sling, is it the proper type and size? Is the bed or equipment correctly positioned? Here are 4 more ways to protect your back and shoulders. Don't carry heavy items with one hand. Don't store frequently used or heavy items overhead. Don't work at or near your own physical limits. Don't work at or below knee height. When it comes to lifting, keep in mind the light concept. L is for load. Consider how heavy the object is. I is for individual. Are you ready and able to handle the lift? T is for task. Are all the tools available and ready? E is for environment. Is there enough light? Is the floor even? For the direct support professional, every day brings different tasks and challenges. That's what keeps the job interesting. Yet these daily activities can lead to injuries. It's important to keep you and the people you're supporting safe at all times. Preventing injuries can start with basic things like proper footwear. Indoors, you'll need comfortable, closed-toed shoes with non-slip soles and no heels. Outdoors, especially in winter, you'll need sturdy boots. Many MSD injuries are caused by improper biomechanics and poor posture. This may be aggravated by how frequently we perform the task, if we're new to the job, or just getting older. See if you can see the difference in biomechanics in the following daily tasks. Let's start with mopping the floor. Notice how this support professional takes long reaches and twists at the waist while mopping. Here's a better way. See how she bends her knees to eliminate long reaches and moves her feet rather than her waist. She also takes shorter strokes to reduce her chance of injury. Use the same technique when vacuuming. Notice the long reach and twisting of her waist. Now, instead of reaching, she maintains her posture and moves her feet rather than her back and waist. Loading and unloading the dishwasher is a routine task. What movements can this support professional improve to avoid strains and discomfort? For better biomechanics, bend the knees and rotate the feet rather than the waist. Standing at the kitchen sink peeling vegetables or assisting with meal preparation can be hard on your back. Consider taking a stretch break, or open the bottom cupboard so you can rest one foot on a shelf. Making and turning down beds is another daily task that can lead to injury. When turning down a bed, avoid reaching over the mattress. Instead, shorten your reach by working on both sides of the bed. Even removing clothes from the dryer can lead to injury. Here's a better way to reduce the chance of injury. Support yourself by bending your knees, rather than using your back to do the work. Lifting objects from the floor is a common cause of injury, especially when you bend at the waist. It's better to bend your knees and bring the load close to your body as you stand up, so you're using your legs, not your back. Always try to avoid working at or below knee height. Look for a way to work upright. You'll be more comfortable. Bending over to clean a tub is a common practice, but a risky one. With the help of simple tools, we can perform the task with less chance of injury. Winter brings snow shoveling and back injuries if we're not careful. Follow these tips. Before you head outside, do some stretches to warm up your muscles. Cold, tight muscles are more prone to injury. An ergonomic shovel with a curved or adjustable handle can minimize painful bending. Bend your knees and back slightly while keeping the shovel on the ground. Choose a lightweight shovel with a plastic blade. Whenever possible, push the snow to the side rather than lifting it. If you must lift, keep your hips and shoulder facing the object you are lifting and move your feet to prevent twisting at the waist. Pace yourself and take breaks. When someone needs a mechanical lift, think about the risks before you begin. What's wrong with this scene? Did the support professional take the time to prevent an injury? As you can see, the support professional extends a ceiling lift strap. She doesn't need to support the full weight of the lift in an awkward overhead position. Take an extra minute or two to figure out how to minimize lifting, especially when reaching overhead at an awkward angle. Helping someone get dressed is easier for both of you if the person is in a standing position. Lastly, never try to break another person's fall and hold them in a standing position. Instead, control the person's fall to the floor as you've been trained. As direct support professionals, we need to help others and maintain our own health at the same time. It's our responsibility to assess the risk and act accordingly to minimize MSDs. You can reduce your chance of injury by following these 4 steps. Keep yourself healthy. Report hazards to your supervisor as soon as possible. Talk to your Joint Health and Safety Committee and use the equipment provided in the correct manner.